Now I request Dr. Abhijit Chatterjee from Charnock Hospital to the stage for his keynote address. Dr. Chatterjee has been a pivotal figure in his collaboration, and his insights and visions have been instrumental in bringing this initiative to a realization.
Good evening, everybody. Thank you so much for having me on this stage. A warm welcome to everybody present here from the hospital as well as the DOGEE team. Part of our quality improvement program, we decided to include DOGEE bed in our mostly ward. Okay, it was a beautiful experience, and after analyzing and auditing, the CPR committee has found out that in last 6 months, port blue in wards have drastically reduced, with only 1 or 2 in last 3 months. And
in the daytime, and about 73% of patients who have never been in critical care after surgery were not admitted to critical care after surgery, passed away, who died in hospitals. Now, normally, a patient is not monitored 24/7 when they're outside of the ICU. They're only looked at about 4 times a day, the vitals. That's the heart rate, the respiratory rate, and the blood pressure and the temperature. Once it happens, the nurse for the next 6 hours does not check whether the person is hemodynamically stable. What that means is whether their vitals are stable. They do see the patient, but they don't actually put the blood pressure cuff on and check if anything is happening.
no, not at all. The role of human nurses, or rather humans, is irreplaceable. Okay, like artificial intelligence can be a conjunct, it can be an adjunct, sorry. Like we have to rely upon human hands. Other than that, medicine or treatment will not work. But yeah, it can help us to reduce the burden on the human nurses. Because it's a worldwide problem. The nurse-patient ratio, there are more patients compared to the number of nurses. So at least it can release a little of their burden so that they can provide us with better care. But it is not replaceable.
So do you think that the patient will take it easily?
Yeah, they will take it easily. They will be more confident about the treatment plan. As Dr. Nikhila was saying, when they think that they are being monitored 24/7, even outside the ICU, it will be better for them. They will be more confident, they will be more relaxed, I would say. And also the relatives, when they're sitting at home, they will be also a little relieved that, yeah, my patient has been monitored 24/7. The doctors will get to know if something happens overnight.
This event is about enhanced patient care that is being launched at Charnock with the help of DOGEE. DOGEE is a technology that Charnock is using to build an early warning system for those patients that are outside of the ICU and allow them to increase patient safety and help with the patient experience. This device measures their vitals at all times, so the doctors and nurses know how the patient is doing. Even if the door is closed, they can see all of their vitals and help direct treatment to make sure that the patient is out of the ICU faster or does not need to go to the ICU. Dr.